I tell you, the thing I didn't like the most about it was I liked to eat and I wasn't hungry.
That's the most common complaint that you'll get is nausea or not being able to eat what you normally want to eat.
You're not going to get a prescription medication just because, if you're thin in shape already and you just want to be skinnier for your beach body for the summer. Have you incorporated weight loss and exercise into your weight loss?
Yes, I see 15 to 18 patients a day and I walk up and down the hallway, back and forth, so.
Dr. Croley, welcome back to another episode of Beauty and the Brain. We're the podcast where we're going to talk about all things aesthetic. Today we have a really exciting episode. We have our guest, Allie Ballew, and I'm here with my husband, Jerry Drinkard, and we're going to talk about weight loss.
And together, Chris and I own Skin and Tonic in Pace, Florida. And Allie, who we have joining us today, she's one of the nurse practitioners at the clinic. And we're going to talk a little bit about some weight loss, something that's hot and trending and what's on everyone's mind.
Oh, yeah.
You guys know that we're always happy to have guests, and especially Allie. So she has to listen to us talk every day. And we're really excited that she actually will take time out of her schedule to come and join us for the podcast. Allie does a lot of things at the clinic. We started out with her, I started working with her as an ICU nurse, but she joined our practice over a year ago now and does many things. So fillers, lasers, and kind of one of the newest things that her and Jerry have decided to bring into the practice is medical weight loss. It's something that I think is a much needed service in our area. It's, we know that obesity is an epidemic in this country, that we're really dealing with it. So Allie, you and Jerry really are kind of the experts on this when it comes to our practice. So you want to tell us a few things about yourself and what got you interested in this and why you wanted me to bring it to the clinic?
Yeah. So I think weight loss is something that we all struggle with, and especially like the patient population that we treat at the clinic. Obviously, they care about what they look like. They care about their health, their mental well-being, all of those things. And I think weight loss is one of those things that a lot of us struggle with that is keeping us from being confident, feeling ourselves, feeling beautiful. And so I think it was the perfect patient population to bring it into. It's becoming very popular nowadays. Everybody wants to know, how are you losing weight? Where do you get your injectables from? What app do I have to download to get that? And it's not always super safe or regulated or monitored the way that people are getting these injectables. So I think it's really great that we have all of these different options now for weight loss, for preventative care, because like you said, obesity is an epidemic and it can lead to many struggles down the road.
I think you nailed it when you said that we have such a population of patients that it really interests, because most people come to us in some fashion or form looking to better themselves in some way. And, introducing a weight loss program, it was really something that kind of controversial in our initial thought process, because we didn't want to be just someone that was prescribing medications. And I think it's real easy to fall into that trap. We have qualifying factors that you and I have discussed, and we developed this plan with Chris. And so I think that, when you consider medical weight loss, that it's not just medicine weight loss, it's actually medically guided. And that there are several things that we have to take into consideration to determine if someone's even a candidate. We'll talk more about it later, but comorbidities and family health histories and that person's medical history, and do they even qualify? Because just because we personally want to lose 10 pounds doesn't mean that you'd qualify for a medication.
Yeah, and one of the class of drugs that, I think we should really just dive into, because it's so popular and it's what's asked for a lot, is some of the medications that people typically think of for diabetes. And so these medications, some of them actually do have a weight loss approval. So it's not just a diabetic drug. And I think people, confuse the names a lot, but one of the branded names is Wegovy, and that actually has just a weight loss indication. But this medication can also be used for diabetes. So clearly that brings with it a lot of controversy as to, are we using medications that are taking away from medications that are available for diabetics. And so how do you guys approach that if somebody asks you about that? How do you answer that question?
Do you want to go?
Go ahead.
So yeah, these are definitely medications that were, originally geared towards type 2 diabetes. But one of the factors of type 2 diabetes, it can be a genetic component for sure, or it can be a weight component. Obviously, our nutrition is a big deal as what we eat, and it's a tool for diabetics too, right? So it's not like it's insulin that we're taking away from them. We're not taking insulin. We're not prescribing insulin. It's not a life-saving medication for diabetics. It's a tool to help diabetics also lose weight and to help
control their blood sugar.
Blood sugar.
Definitely.
Yeah.
The way that these medications work for weight loss is one of the ways that they also help to control diabetes and symptoms of for diabetics that can be actually dangerous. And so the slowing of the gastric emptying, for instance, the GLP-1 antagonist, they decrease that craving for hunger that makes us tend to overeat. A lot of people, you don't have that craving for sweets that people often have, but they also come with some side effects. It's not just an injection that you automatically lose weight.
One of the differences I kind of want to talk about is two of the big name brands. You talked about Wegovy, which has been FDA approved for weight loss. Mounjaro is undergoing FDA approval right now for weight loss, so they're still in limbo there. But two of the big ones that I think that people know by brand is Ozempic and then the Mounjaro. So the difference between the two, people do see more weight loss with Mounjaro, since we're just talking about weight loss right now. But you said the GLP-1 antagonist. A lot of people want the tirzepatide or Mounjaro because they have read, which is accurate, that people are experiencing more weight loss on the Mounjaro, which is true. It's also a much more expensive medication. One of the reasons might be that it also, you mentioned the GLP-1 antagonist, it also works on GIP receptors, and it's been proven in diabetics to lower their A1C, which is an average of your blood sugar over about 3 months. And so people do experience more weight loss with it and less side effects, but the semaglutide, which is the compounded version of Ozempic, is a lot more affordable for patients and has been more readily available.
So while we're talking about we know diabetes is a qualifier for access to these medications, but what are some other qualifiers for patients that are weight loss candidates that we would look at to qualify them for the medication?
Yeah, so for us, we require a BMI greater than 30 or a BMI greater than 27 with at least one comorbidity from weight gain.
And some of those comorbidities that could be weight related are things such as elevated cholesterol levels, the high blood pressure, hypertension. And so those are probably the most common qualifiers with a BMI that's, greater than 27.
So Jerry, at one point you did meet those criteria and decided to try some of these, one of the medications through another provider before we started doing weight loss. And do you want to talk a little bit about kind of your experience with it?
Yeah, I tell you, the thing I didn't like the most about it was I liked to eat and I wasn't hungry. But the other side effect I had was weight loss. I had pretty significant nausea after I had my initial increase in dosing. When I did the semaglutide and started at a 0.25 milligrams and didn't have really any bad symptoms at that point. But then once I went to 0.5, I started experiencing a little more nausea. Constipation is pretty common with a lot of patients, which fortunately I did not have. And it was almost like the nausea would come in waves. Like it wasn't consistent. But if I happened to overeat or ate foods that were high in fats, that's when I felt the worst.
Allie, is that pretty much what you're seeing that's consistent with a lot of our patients now?
Yeah, that's the most common complaint that you'll get is nausea or not being able to eat what you normally want to eat. But I think it's kind of good, like how Jerry mentioned, that he was most disturbed when he ate those like high caloric or this high fat foods, because you're almost like training your body, because this isn't a medication that we want you to be on forever and ever, amen. This is something to use as a tool to jumpstart your weight loss, to have a healthier relationship with food, and to make that lifestyle change sustainable.
And it truly is a tool. And the way that I talk to my patients during our consultation is to keep in mind, like when you're on the medication, what is it taking for you to get full? to reach that level of satisfaction. And keep in mind that when you come off the medication, to continue to eat those portions. And some people use tools such as eating off of a smaller plate, or just doing a single serving of ice cream instead of a double scoop, or having soup from a cup instead of a bowl. And so these little things are part of what we do as weight loss coaching. And so it's not all medication driven, because some people don't have the qualifiers to get medication. And I think accountability is part of it. And so I think if you have a medical professional that's paying attention to you and wants to keep you off of cholesterol medicine, keep you off of high blood pressure medication, and keep your BMI below the qualifying numbers, then I think they're paying us for a service, obviously. And so I think when you pay for a service, you've mentioned it before with a trainer, that you feel more accountable to go to the gym because you don't want to disappoint that trainer. And I think our patients see that a lot of times. We want to keep you below a certain weight, and we give you these tools. If you follow these, then certainly we can help you. But for those patients that can't, there are other things that we can do.
So which patients are not candidates? So let's just take off the table the patients who are too thin. So I mean, we have patients that are thin, that
It's not for somebody that wants to lose 5 pounds before a wedding.
Right. And if they're and we had somebody recently that's I think in the 90 to 100 pound range, like pretty thin, and was wanting weight loss medication. So, I mean, definitely let's take that off the table. So besides not meeting the BMI or the weight criteria, what are other conditions that patients would not be able to get this medication?
So an absolute no is going to be anybody who has had personal or family history of thyroid cancer. And then another very rare side effect of this medication can be pancreatitis. So anybody who's had a personal experience with acute or chronic pancreatitis, we wouldn't suggest this medications for. By the way, it only happens in like 0.27% of patients, but it is there as a possible side effect.
And, I think it's that's an important thing to point out, because, whether we like this or not, we know that a lot of patients will take medications from their family members or from their friends that they weren't using. And so that's why we do encourage you to see a medical professional, make sure that you're being followed properly. But it's also pancreatitis, your risk for that is going to increase if you increase your dosing too rapidly. So when patients want to go straight to a higher dose, we actually have our protocol increases them over time to slowly bring their dosing up to try to minimize the risk of that side effect. So if you guys are listening out there and any of you guys are considering taking something from your family member or friend, make sure that you are aware that these things are medications that can have serious side effects. And so in the clinic, we like to kind of guide you through this and bring you along this journey where we help you in multiple ways, not just with the medication, but talk about other things that you can do to maintain this weight.
Well, the medications, I think what a lot of people don't realize is it does make the pancreas work a little harder, because there's an increase in the secretion of insulin. And when you have a pancreas that may be possibly inflamed or aggravated or a little bit angry for some reason, and all of a sudden you put more work on that pancreas and say, I need you to do some extra work, that's where the risk for pancreatitis increases. And so if you all of a sudden you've increased the workload of the pancreas, then certainly you can, and it's not something that's easily dealt with, and it can be a pretty serious condition that we want to avoid at all costs. And so I think especially on that first 4-week track, people are really tempted to want to increase their dose because they're not seeing the weight.
I only lost 5 pounds this week. Oh my God, that's a ton.
Yeah. And so we do see people wanting to increase their weight. And so we have to remind them, because a lot of this, like we do our work in the clinic, but it's also work on a patient, and the responsibility of administering that medication is a home, it's a home treatment. You may want to talk a little about that.
Yeah, is it hard to administer at home for patients who want to know?
It's super easy. You can barely feel the needle. We help you in the clinic whenever you come in during the consultation. If we decide that you are an appropriate patient for this medication, we help you. I always encourage my patients to do it themselves with me right there. Sometimes they want me to do it for them, but we show them how to do it, how to store their medication appropriately. It's a once-weekly injection. I usually encourage my patients to do it right outside of their belly button and that abdominal fat tissue. You can also do it in the leg, but just whatever they're comfortable with. It's a super easy, quick injection. It's not difficult to do. Anybody could do it. You could train your partner how to do it. I tell them, if your husband or wife or your kid or whoever, not small child, adult child, is going to be the one injecting this medication, bring them in with you for the appointment. And so we can show them how to appropriately administer the medication. And I do want to make a point too that yes, it does make your pancreas work harder for you, but it is also a safe medication that if you do have a healthy pancreas and normal functioning pancreas, even if you reside on the lower side of a blood glucose level, it's not going to make you hypoglycemic, meaning make your blood sugar drop to a unsafe or low level.
So in addition to nausea, maybe, being the most common thing, and decreased appetite, which a lot of people actually, kind of like that. Any other big side effects that people need to watch out for?
Constipation.
Yeah, you mentioned that one. Yeah. So
you can't have diarrhea. Diarrhea, I think, is one of those things that comes after eating like a greasy, fatty meal. It happens sometimes. And I always tell my patients to be very mindful of your water intake, because that is going to lessen your chances of constipation. I think sometimes when you have that full filling from that slowed gastric motility, you don't want to drink, but you have to.
And I think we've seen, like, since we've been doing this, people who follow the pathway, kind of the dose increment increasing that we prescribe for them, really have minimal side effects. They actually do quite well on this.
And that's the great thing about coming to medical professionals that you have access to that are in like where you live, and not getting it from an app online, because they don't care that you're having nausea. I mean, maybe they care, but it's not easily accessible, because you can call us and say, hey, I'm having insane nausea with this dose increase. And we say, okay, come back into the clinic. We'll get you back on the lower dose. And that's something that we can do real time versus having to wait for a provider through an app or somebody that you can't get in contact with immediately.
And these doses aren't set in stone. And we have patients that were previously on Ozempic and have gotten to the maintenance phase and just wanting to maintain weight. And so, we have a couple of patients actually right now, and they're actually doing bi-weekly dosing of a little lower dose just to maintain. And so that's, I think, the beauty of a true weight loss program rather than doing a mail order type weight loss, is it's tailored to that specific person and tailored to their needs.
So yeah, there's I want to just comment briefly on the compounded medications, and then we'll ask you guys a couple questions on other things, because clearly semaglutide is what it has the most traction right at this moment. Lots of people call about that. That's what we're getting the most questions about, and kind of why we're doing this podcast. It's some controversy around the compounded forms, and I think some of the companies out there, they haven't been able to manufacture the branded form in quantities enough to keep up with the demand. And so because there's been a shortage, that does allow compound pharmacies to compound the active ingredient in these medications. So if you're getting a compounded form, you want to make sure that you're working with a provider who's using an accredited pharmacy that is sourcing their materials appropriately, and providing them in a manner that we can inject or provide an injection for you that is sterile, so that you minimize your risk of infection or injecting something that's not approved and just kind of ordered offline. So that'd be one of my tips for anybody out there asking, like, how can we get this compounded now? And as production is increasing, some states are no longer allowing compounding, and so these rules may change, and we'll obviously stay up to date and kind of adjust our therapies and what we offer in the clinic as the availability of the medications change, and if there's any regulation changes around that. But in addition to semaglutide or tirzepatide, let's talk about some other things. There are obviously other weight loss medications out there. They have a little bit more side effects, and so I would say that they're not as common, but we do offer those, as we can talk to you about those options in the clinic. And they also have BMI criteria. So, I think the takeaway is that you're not going to get a prescription medication just because, if you're thin in shape already and you just want to be skinnier for your beach body for the summer. We're probably going to offer some other things to you in that case, which are...
A diet plan.
A diet plan, yeah.
An exercise plan.
Yeah.
I think all of this goes hand in hand with a healthy lifestyle. You can't continue to do what you were doing prior to starting a weight loss program and think that it's going to be maintainable. And so I think Certainly adequate sleep plays a huge part of just our overall health and well-being. It changes our metabolism. We see people that are, a lot of healthcare workers that are on, swing shift, night shift, whatever you want to say, and they battle weight because of the sleep cycles. And so people just don't realize the importance of sleep cycles. They don't realize the importance of water intake, that daily exercise, even if it's 30 minutes a day. And all of these things are really easy to incorporate into a lifestyle. And the exercise, it doesn't have to be going to the gym. You can get your dog out and take your dog for a walk. And that does good for the body and the mind. Goodness, we all need a mental
Have you
break.
incorporated weight loss and exercise into your weight loss?
Yes, I see 15 to 18 patients a day, and I walk up and down the hallway, back and forth. And I have to serve you king, Chris.
Yeah, Jerry gives me a hard time because I ordered a tonal, an exercise piece of equipment for the house. Yeah, and how long have I had it? Several months, and I haven't even powered it on yet. So I'm definitely
I'll say
not.
The reason he hasn't powered it on is because he starts having to pay the subscription the day he turns it on, and he doesn't think that he's going to do it routinely, so he just lets it hang on.
Perfect.
And Allie, what about you?
Yeah, I love
You're an
to walk my
exercise fanatic?
dog. Yeah, I just grind it out on my Peloton every day. No, I do like my Peloton. I had to get bike shorts because those bike seats
Had to look
hurt.
cute.
No, it's not. No, they're padded bike shorts. Just piggybacking off of other things that we offer at the clinic that I thought of when we were talking about that is we do IV therapy, which also includes vitamin D shots and the lipo B12 shots. So a lot of people struggle with exercising or the motivation, and maybe it's low energy levels. Maybe you have low vitamin D, and those B12 shots can also help you to have less side effects when you're taking medications like semaglutide.
The key to that, we kind of joke about it, but is that, we all struggle even maintaining a healthy weight, and we try to say just incorporate a few minutes of exercise into your routine daily, but it is difficult. It is something that takes, planning, and as much as we encourage that, we also struggle with those same things ourselves that everybody out there listening struggles with. It's not something that's easy for any of us, but we see benefits when we do it.
But I also think it's important because we're not a primary care clinic. That's not what we do. And I think it's very important to recognize those patients that need something more than what we provide. And so, there are oftentimes weight gain that's associated with things that we aren't doing, such as, it can be thyroid imbalances, or it can be, hormonal changes. We see a lot of that in our perimenopausal, postmenopausal patients, or patients that are suffering from some type of, inflammatory process that does limit the physical exercise that they've been able to do in the past. And so I think it's really important to, as medical providers, to realize when it's time to incorporate someone else or to collaborate with another professional that can give the patient because we want an overall well-being for our patient. We don't just want to strip somebody of 30 pounds and not understand what's the reason behind this. I think recognizing all of that's important as well.
All right. Tell us one of our success stories. And for you guys, I know a lot of people listen, but if you're watching, or if you want to go watch, go to YouTube, because we do have videos of all the podcasts on YouTube as well. And we're going to put some before and after pictures that you can see on there.
Our most recent success story, she's a 44-year-old female. She's a school teacher, mom of 3 kids. Her lifestyle has actually changed a lot because rather than doing exercise for herself, she's a soccer mom. She's running kids from point A to point B. And over the course of the past year or so, couple of years, she had gained 20 pounds. That she was not able to get rid of. Her BMI qualified her, but in addition to that, she was also starting to have, had been placed on HCTZ, very mild diuretic for blood pressure issues. And so she started on a low dose of semaglutide. We started her at 0.25. And over the course of 5 weeks with a titration in her medication, she was able to lose 15 pounds. and she actually had very little side effects. She didn't complain of nausea. She didn't complain of the, the typical things that we've already discussed here. She feels like it's one of the easiest things, that is something that's easy to maintain. She wants to lose a little more weight, but she's like, I think she's probably one of the perfect weight loss patients.
Yeah, she looks amazing. So, I mean,
So
yeah.
if you're following us on YouTube, you'll see some of her before and after. So I'm really proud of her.
All right. Thanks, everyone, for tuning in for this week's episode of Beauty and the Brain. We look forward to seeing you next week.
See you soon.